As the state continues to see a record number of COVID-19 cases and hospitalizations, our healthcare leaders are urging everyone to protect themselves and others from getting the COVID-19 virus. Steve Palega is the Chief Nursing Officer with University of Michigan Health West. Great to see you. Thanks for being here again.
Yeah, thanks, Michelle.
You know, as we've talked before, the hospital has been at or beyond capacity. Where are things standing right now?
Pretty similar to what's been going on since the fall. We've been at some of the highest numbers that we've ever seen. Our emergency department is very busy, still some high COVID numbers. We peaked out a few weeks ago at about 88 COVID, and we still have 50 COVID patients in house today. I think the biggest challenge we're seeing right now, though, is it's not just COVID. It's a lot of strokes, a lot of heart attacks, and a lot of slip and falls right now. A lot of just really pretty bad orthopedic injuries requiring surgery. So very, very busy hospital with a lot of things right now.
So pretty typical for this time of year, but adding COVID to that has really pushed you guys.
Yeah, it certainly has. Really busier than we've ever been, and now our staff is starting to go down with COVID. So we're working on some shortened staff and just doing the best we can to continue to do as many surgeries as we can. We evaluate those every day, but we want to make sure that we're here to serve the community.
Let's quickly talk about the symptoms of Omicron. They really do mimic cold symptoms.
Yeah, they do. Really, people can get a cough. A lot of times you have you're just very tired and a lot of fatigue, congestion, runny nose, a mild headache, and a sore throat. Those are some of the things you see with Omicron. And I think what we're seeing is that people that are vaccinated and have had the booster usually get those milder symptoms.
Yeah, that of course is really good to hear. And let's talk about that too, because we are hearing sometimes people saying, well, are the vaccines working? But this actually is showing then that they are.
Yeah, absolutely. We're seeing that they're very effective at preventing hospitalizations and even deaths. And I would say of those 50 people we have in the hospital right now with COVID, 44 are unvaccinated. So we know just from what we see that the vaccine is helping to keep people out of the hospitals.
Yeah, that is good. Let's talk about kids then. We hear that kids are also getting croup.
Yeah, croup is something that comes along usually in the fall, and any of the parents and grandparents, it's characterized by that barking cough, and yeah, we're starting to see that a little bit. We didn't get a lot of that last year, actually. I think some of our social distancing, some of our masks, and our hand washing, the focus on prevention, I think helped to prevent that. But yeah, that is something that's very characteristic of the winter season.
Yeah. Well, one, it is good to hear that things maybe have peaked a little bit. And of course, we encourage everybody to keep doing what you say they're doing, wearing a mask and washing hands and social distancing.
Yeah, absolutely.
Yeah. All right. Well, great to see you. Steve, thanks so much. Appreciate it.
All right. Thank you.